I am Dr. Devender Singh, Cardiothoracic Surgeon. I am head of the Cardiac Surgical Unit and Heart Transplant Center at Tricolour Hospitals, Vadodara. We do an entire range of cardiac surgical procedures, including heart transplantation, minimal invasive cardiac surgery, as well as thoracic surgeries. So your heart beats for more than 100,000 times a day. In just about a minute's time, each heart pumps about 5 liters of the blood throughout the body to enable all the organs to function normally. So heart carries so much of importance. If heart is okay, the whole body functions well. So heart is basically a muscle. So if the muscle gets damaged, say because of heart attack or any other reason, then the heart is not able to pump that amount of blood throughout the body. So that condition is called as heart failure. Most of the times the heart failure is treated initially with medicines, and at times there are conditions which can be treated surgically. When there are no medical or surgical options available, then we refer these patients for heart transplant. Heart transplant is a situation where we replace the old and damaged heart with a new, healthy, functioning heart. So this heart transplant is indicated when the patient has got heart failure and they are not able to perform day-to-day activities or even lying down on bed with normal ease. So people who become breathless on walking or on lying down, or they develop swelling in the feet, should get themselves tested to see whether they have developed heart failure, and we have a definitive solution in the form of heart transplant. In India, we have been lagging behind as far as the Western nations are concerned. In Western nations, more than 1 lakh transplants are being done yearly. We have picked up pace in recent years. Currently, I would say we do more than 125 transplants in a year in India, and the pace is picking up now. Because of the population, our donation rates are going up, although it is still low at less than 0.5 per million population, whereas the donation rates in countries like Spain is as high as about 50 per million population. But as we pick up pace, I think we should be able to offer the transplant surgery to more and more patients. In the current situation, more than 5 lakh patients need a transplant in a year, and which we are offering to less than 200 in a year. So there is good scope to increase this particular specialty and to help these patients of heart failure. So once we identify the patient and we test the potential recipient to ensure that they are healthy enough to undergo this demanding surgery. So these patients are registered through the hospital with State Organ, Tissue and Transplant Authority, which is called as SOTO. So then the next step is to match the eligible recipient with a heart donor. So initially we do all the testing in the recipient to ensure that he has got only problems related to heart and he's got only heart failure and the other organs are healthy. Then only he will have a good result in the long term. So currently in India and in other parts of the world, the donors for the heart transplants are comatose patients whose brain is irreversibly damaged because of the brain injury. The brain injury could be because of the road traffic accident, because of the brain stroke, or because of the brain tumors. But they still have healthy functioning heart and other organs. So these are the ideal patients who can donate the organs and save many more lives. So once the patient is registered with heart failure with the SOTO, these patients have their blood group and other displayed with the SOTO, and if we have a brain dead donor in a particular hospital, then we match the blood group types and if the recipient has got the same blood group as the donor and other antigens are also same, then we can proceed with the donation of the heart from the comatose patients. These donor patients need to be maintained in the intensive care unit so that they have maintained adequate blood pressure and they have good urine output, their kidneys are preserved, they do not develop any infection. So we have to take care of these donor patients, because if the other organs are healthy, then an individual donor can donate almost up to about 8 organs. So what I mean to say is that one person who is dying can save 8 more lives. So it is the greatest act of charity any individual can do in his life. Currently, all over the world, the results are very gratifying. On an average, any patient who received the heart transplant operation survival rate are as high as about 70% at 10 years time. Tricolour has recently started heart failure and lung failure clinics, which is conducted on every second Thursdays and Saturdays of every month. So what we do is that we have a coordination and collaboration with one of the largest center in the country, which is KIMS Hyderabad. So we have specialists coming down from these hospitals who screen and prepare the patient for heart and lung transplant surgeries. We on our part on day-to-day basis screen patients and prepare them for the operation, and as well as improve their lives by giving them the latest and the current drugs. So in the process of this, we are contributing our part to improving lives of heart failure patients in and around Vadodara, and very soon we will be starting our own heart transplant surgical center here, where patient need not travel to Bombay or other bigger cities and spend more money in not just the surgery, but with other relatives and family members staying there for a few weeks or months, and they end up spending almost double the amount of the amount required for the surgery itself. So here we will be offering all the services, and then for the patients the follow-up also becomes easier, because once he's got the operation done, we are going to be available here round the clock to take care of the issues or complications that develop following transplant, such as immunosuppression. Because any patient who receives a heart from another person, the immune system in the body recognizes that as a foreign organism and is prone to attack it. To prevent this attack, we give immunosuppressant drugs which suppress or reduce the immune reaction in the body. So now this is a double-edged sword. It does suppress the immune system, prevent the recipient heart from getting damaged, but also makes the person susceptible to infection. So in this particular scenario, the patient needs to be in follow-up of his doctor, surgeon or the cardiologist, who will evaluate carefully the amount of drug that needs to be given and will titrate the doses so that patient remains healthy and he does not develop any complication. Plus, these patients, we need to gradually get them back to normal life by taking them through the cardiorespiratory exercise testing and rehabilitation program, which is actively being done in our regular cardiac surgical patients at Tricolour Hospitals, Vadodara.